This is HealthWise Alternatives with Jackie Bell, promoting good health through information and education.
Hi, welcome to HealthWise Alternatives. I'm your host, Jackie Bell. Today we have with us again Dr. Kristine Soly, who is a holistic cardiologist on Cape Cod. Welcome, Dr. Soly.
Thank you.
Thank you so much for coming back. Today our topic is preventing and reversing heart disease. I want to first, though, give you a little background on Dr. Soly. She has been in the private practice of cardiology and for the past 25 years has been practicing holistic cardiology and medicine, where her practice is grounded on building a strong doctor-patient relationship. Dr. Soly is the director of the Holistic Cardiology Learning Center of Cape Cod in Yarmouthport, Massachusetts, which is a resource for learning how to holistically treat chronic and preventable medical conditions, especially coronary heart disease. Dr. Soly, welcome back to our show. And we've long been talking about this show of preventing and reversing coronary heart disease. So if you would like to just explain a little bit about how you help reverse and then eventually prevent coronary heart disease, that would be great.
Well, I'll start back, I think probably talking about how you get coronary artery disease in terms of understanding prevention and reversing. Normally in our body, our arteries, there is no plaque. There's no buildup of what you think of as cholesterol in the arteries. There's no hardening of the arteries. But actually relatively early on in our lives, we actually have a situation where the lipids, and lipids are cholesterol and triglycerides. Somehow we always talk about cholesterol, but it isn't just cholesterol. Cholesterol is really a waxy substance. It isn't a fat, it's a waxy substance that's essential for all your cells and essential for life. Our cholesterol is used to make our hormones. It's used to make vitamin D. It's used to do all our cell repair. It's used to make bile. So cholesterol is a very essential component, but it is a waxy substance, and it's only found in animal products. Triglycerides are fats, and they are the breakdown products of the fats that we eat. Fats are also very important for us. The triglycerides are important for making the fatty acid membrane around every cell, and also fats are a very good source of energy for us. So both are essential, but in terms of understanding how we get into trouble with them, it's important to understand how we deal with cholesterol and triglycerides. And cholesterol and triglycerides are called lipids. And in your body, or in my body, or in our bodies, these lipids get absorbed. Now, let's say we eat something that has fat and cholesterol in it. It will be broken down and it will be absorbed into the GI tract. Because they're wax and fat, and because our blood is water-based, you can't just put wax and fat into the water-based bloodstream, otherwise you'd have salad dressing that isn't mixed up. And you'd have globs of wax and fat traveling in your bloodstream, and we know that doesn't happen. So what happens is that we have to have a way to transport these lipids in a water-based medium, the blood. And we do this with lipoproteins. Now, it's interesting that we talk about lipoproteins all the time, the low-density lipoproteins, the high-density lipoproteins, but nobody ever thinks about what they are. And when you eat lipids and absorb them, you have to have a lipoprotein right there as it's being absorbed so you can transport it. And the lipoproteins are carriers. They're like little taxi cabs or like submarines, something to carry the lipids in. The inside is lipid and the outside is protein. So the inside is soluble with cholesterol and triglyceride and can wrap right around it. And the outside is protein, which is soluble in water. So now, as soon as you eat lipids, your liver makes these lipoproteins. They go down and they greet the lipids, wrap around them, transport them pretty much back to the liver. And from the liver, different lipoproteins take cholesterol and take triglycerides to wherever they have to go. So when you have your blood checked for cholesterol, you've been fasting for 10, 12 hours. So what is being measured is not the cholesterol or the triglycerides that you've eaten. That's pretty much all been delivered. What is actually being measured is the lipid that makes up those lipoproteins. So it's the carriers that we're actually measuring. And we have different carriers. The ones you're most familiar with are the low-density lipoproteins, which are supposedly bad, and the high-density lipoproteins, which are supposedly good. Well, and nothing, of course, is as simple as it seems, and lipoproteins are not that simple. But not all of your LDLs or low-density lipoproteins are bad. In fact, you can have big fluffy ones, which are pretty harmless, or little small dense ones, which are a problem. And the reason that LDL even gets involved in plaque is not because the LDL or the low-density lipoproteins cause plaque, but they get oxidized in our bloodstream. Now we know that we breathe oxygen, and we use oxygen to metabolize. And so it's a fact of life that things are going to oxidize. If your lipoproteins, the LDLs in your bloodstream, did not oxidize, nothing bad would happen. But they do oxidize. And when they oxidize, they do not just layer on the surface of the artery. It's not like dental plaque where you can scrape it off. When we form plaque in our arteries, those lipoproteins that oxidize, they actually go right into the wall. You have this endothelium, this little thin lining inside your arteries. And the lipoproteins actually go right through that into the wall. Well, now your body knows that's abnormal, knows that they don't belong there, and it sets up this inflammatory reaction to get rid of it. That's what we call plaque. And so, in terms of getting rid of plaque, we have to kind of go back to how did we get it to begin with. So if we look at the fact that the LDLs have to oxidize, well, we first of all get an idea that maybe antioxidants do play a role. And of course, if you can keep LDLs from oxidizing, you can reduce a lot of plaque. Now, I know you've been hearing a lot, I'm sure everybody has, in the media about, the vitamins don't work. And although this doesn't really have anything to do with preventing and reversing heart disease, I think it's important to understand how those studies came to be. That research involving natural substances is quite different from research involving drugs. And unfortunately, we have conventional scientists and conventional physicians who are used to doing research with drugs, now trying to do research with natural substances. If you're doing research with drugs do not exist naturally in nature, otherwise they couldn't be patented. So a drug, by definition, doesn't occur naturally in nature. So if you want to see if a drug works, you get two groups of identical people who are pretty much matched in terms of age and diseases and sex and all that. And then you give the drug to one group and you don't to the other. And then you compare and see what happens. And that kind of research can be done with a drug because only one group's going to have the drug in their bodies. You can't do the same kind of research with natural substances. First of all, the natural substances occur in nature, so they're already in our bodies. So how do you get a control group? You're now going to pick two groups of people, and interestingly enough, in the research that's been done, nobody has checked to see what the levels were of the natural substances to begin with. So nobody knows whether you have more, you have less. You don't know that the groups are the same in terms of baseline. And also in nature, things work together. It's not like drugs where it works all by itself. In nature, not only do we have a number of various vitamins, like for instance, vitamin E has 8 different forms. It has, alpha, beta, gamma, delta tocopherol, and alpha, beta, gamma, delta tocotrienols. And there's 8 forms of vitamin E that exist in nature and in our bodies. For the carotenes, you've heard of beta carotene studies. The carotenes must be 10 or 12 different carotenes. We have alpha carotene, beta carotene, lycopene, lutein, zeaxanthin. We have a lot of carotenes. And in nature, all the vitamin E's work together, and all the carotenes work together. And in addition, all antioxidants work together. So vitamin C, mixed vitamin E's, mixed carotenes, they all work together. And you know, the reason that antioxidants work, I oftentimes think people don't perhaps understand why do we care about antioxidants. That essentially, since we're made up of atoms, and you know, we have the nucleus, and then you have these electrons going around in orbits. Well, from chemistry back in high school, probably the only thing we all remember is that for an atom to be stable, it has to have paired electrons in the outer ring. And so all of our atoms are paired electrons in the outer ring, so we're quite stable. A free radical is an atom that's missing an electron in the outer ring. And a free radical is going to get an electron at all costs. So here you are with all your atoms nice and stable, and along comes a free radical. It's going to come down and it snatches an electron off of you. Now the free radical is stable. Now you're a free radical. And then you snatch an electron off the next, and the next, and the next, and the next. So the free radicals damage us by snatching electrons off. And in nature and in our bodies, the purpose of antioxidants is to provide substances that can give up electrons without becoming unstable. We can't give up electrons without becoming unstable. But vitamin C, vitamin E, the carotenes, these are great, selenium, these are great antioxidants. And they have double and triple bonds that can break and give up electrons, and yet the compound stays stable. Now, if you take enough electrons from an antioxidant, you can make it into a free radical. But that's why the antioxidants work together. For instance, vitamin E is easy to snatch the electrons off of, and it would eventually, the vitamin E's would become free radicals. But the vitamin C and the carotenes reconstitute the vitamin E. And so when you want to do research, and you have things that occur in nature, and that all work together, and that occur in our bodies, then it's harder to get two groups where one will be a control and one can be the study group. Right. In addition, if you're going to do research by giving, let's look at the vitamin E study. Most vitamin E supplements in this country are alpha tocopherol. And alpha tocopherol is just one of the vitamin E's. It is the most prevalent in nature and the most prevalent in our bodies, but all of our organs don't use alpha tocopherol. So we're going to do a study where we're going to give one group of people a very large dose of alpha tocopherol. What we're essentially going to do is dilute out all the other vitamin E's. So we're going to end up with a high level of alpha tocopherol and a deficiency of everything else. The heart doesn't use alpha tocopherol, it uses gamma tocopherol. So the finding that when you give large doses of alpha tocopherol to patients, they get more heart disease shouldn't have been a surprise. So instead of concluding that vitamin E causes heart disease, what should have been concluded is that a gamma tocopherol deficiency causes heart disease, and when you give alpha tocopherol, you create a gamma deficiency. So in terms of doing the studies, it's very important to understand that they can't be done like they can with conventional. But anyhow, antioxidants, we know unequivocally, and even the research will state that if you get your antioxidants from food, they clearly work. And the problem comes when you give supplements, and that's why you have to be careful about what supplements you give. And something I'm always mindful of in the office is, that I recommend supplements that are balanced, that mimic nature, that mimic food, right, and that not just beta carotene or not just alpha tocopherol. Right. So in our bodies, the LDLs, back to the forming plaque and preventing it, the LDLs get oxidized. And if they're the little small, tight, dense ones, they actually can fit right in between the endothelium and go into the wall. But if you could prevent the oxidation, then it wouldn't be a problem. Now, that of course would be too simple. There are actually lipoproteins that you've never heard of, like remnant lipoprotein, that don't have to oxidize to stimulate plaque formation. And so in terms of dealing with preventing and reversing, it's going to be important for physicians to start recognizing that it's not as simple as good cholesterol, bad cholesterol, that there are many forms, and that it's not cholesterol, that it's lipoproteins. And so if you have somebody who has the lipoproteins have gotten into the wall, the inflammatory process has started, by the age of 2 in this country, 100% of 2-year-olds have the earliest manifestations of plaque. And it speaks a bit to our nutrition in this country,
Right.
but 100% of 2-year-olds have the earliest manifestations of plaque. Once you have the start of plaque, it will progressively worsen because your body's trying to get rid of it. And so you send in white blood cells called macrophages. They go in, they gobble up the lipoproteins. And well, macrophages are great. They can kill bacteria, they can kill viruses, they can kill fungi, they can kill cancer cells. They can kill things that are alive. And they're a great source of protection from infection and cancer for us. They can't kill lipoproteins because they aren't alive. So now in your plaque there, you have macrophages filled with lipids. So now this is more of an abnormality. And so your body tries harder and harder to get rid of this, and it just gets worse and worse.
Right.
You lay down collagen, you lay down fiber, the smooth muscle cells in the wall will multiply as if they had cancer. They multiply completely out of control. Nobody really knows why. Maybe try to wall off the plaque, but they will multiply, and so you become crowded with muscle cells, and you have these macrophages filled with lipids, which are called foam cells. You have fiber, you have collagen. You actually will grow blood vessels right into the plaque to bring more cells. So you end up with a real inflammatory mess.
Right.
Now,
Right.
in coronary artery disease, or in our bodies actually, plaque ruptures and heals all the time, from the time we're 2 years old.
Oh.
And it ruptures and heals and ruptures and heals and ruptures and heals because that little endothelium over it is only going to hold in so much, and as this inflammation increases, it ruptures, spews out some of this necrotic core, but it happens all the time, and mostly we get away with it. Nothing bad happens. But every time it ruptures and heals, the plaque gets bigger. Now, you know that you hear about people, they have a 95% narrowing of the blood vessel, and they have 99%, and you hear about, we have to get that vessel open, we have to do bypass surgery, we have to do angioplasty, we have to put in a stent. Actually, the more times that the plaque is ruptured and healed, the larger it is, but also the thicker the cap. So that by the time a vessel is narrowed 75% or more, that cap is pretty thick. And the core is pretty small. That lipid core is pretty small because it's spewed out so many times. That plaque is very unlikely to rupture. Even though 75% or more narrowing of a blood vessel causes symptoms because not enough oxygenated blood gets through, so you get chest pain with exertion or short of breath or fatigue. If your stress test were done, it would be abnormal. And if you had a cardiac cath, you'd be told you had critical disease, and they'd want to get that vessel open. That, however, is actually stable plaque. This is something we've known since the 90s. And that is very unlikely to cause a heart attack. It may cause a lot of symptoms, but it doesn't cause heart attacks.
And the heart attack fear would be that it would rupture and burst and then clot. Yes.
But that's a very thick cap, so it's
Right.
not likely to rupture. Only 15% of heart attacks and stroke come from that. The other kind of plaque we have is not narrowed that much. Say it's 50% narrowed. Plenty of blood gets through, so you don't have symptoms. If you did a stress test, it would be negative. If you did a cardiac catheterization to look to see how much plaque, you'd be told you had insignificant disease. Don't worry about it. That's unstable plaque. 85% of heart attacks and stroke come from that because that cap is not very thick, hasn't ruptured and healed that many times. If that ruptures and spews out core and a clot forms, you have a heart attack or stroke. So we're treating the wrong disease, first of all.
Right.
We're treating stable plaque in most patients, and we're ignoring the unstable plaque. So if you want to prevent and reverse heart disease, first of all, do no harm.
Right.
You know, in the media this past year, we've certainly heard a lot about stents
Yes.
and elective angioplasties. Well, I mean, I've been saying for years, we're doing too much invasiveness with cardiology. We're creating more disease than we're healing. That angioplasty, where you go in and dilate the plaque and crush it, and stents, where you go in and put a little wire mesh to prop the artery open, they were designed to be done at the time of a heart attack. If you're having a heart attack, anything you can do to get that vessel open will save muscle, save lives, give you a better quality of life. What happened was, though, that doing angioplasty and doing stents, which is very profitable for cardiologists, it got to be done electively. Now, it was never designed to be. But the thinking was, well, gee, if it saves muscle and it saves lives at the time of a heart attack, how about we do it in everybody who might have a heart attack? And it's sort of like taking out everybody's appendix just because, you know, you might get an appendicitis and it might rupture. And so what happened was they began to put stents in electively in people who were not having heart attacks. And for those who followed the media, what they found was that they ended up having more problems than if they didn't do it. And that indeed now finally this past last March, the American College of Cardiology came out with a very large study that demonstrated unequivocally that elective angioplasty and stents do not improve your outcome. They make it worse, and that lifestyle changes and conventional management, medical management, actually works better.
So prevention would be lifestyle changes.
Well, actually, prevention and treatment, the same thing. That things we've talked about before, changing the way you eat, exercising regularly, learning a relaxation technique, and developing social and emotional support for the intimacy. And you know, it isn't necessarily clear why would that work better. Because people think, well, if I put a stent in, it opens the vessel up right away, doesn't that solve the problem? But we have to remember that disease in that one place is other places.
Right.
We don't have narrowing in just one artery or just one artery system.
Right.
It isn't just the heart. There's the carotids, there's the brain, there's the kidneys, there's the legs. And so if you want to change the outcome, I always think of it, it's kind of like a road, that the bridge gets washed out. And then a little farther down, an avalanche occurred and it's blocking the road. And a little farther down, the road gave way and it was just washed out by a stream. Well, on this road, if you go and rebuild the bridge or build a bridge around, you still can't use the road. And so in our arteries, just correcting one spot doesn't solve our problem.
Also, by doing that, you do not address the disease process that's underlying.
Yeah. Well, you don't. You don't address either the oxidation issue, you don't address the lipoprotein issue, and so the whole thrust of lifestyle change is to address it from a very basic level. In other words, if you don't know how you got there, then you don't know how to undo it.
Right.
And if we could make lifestyle changes for everybody, not just for heart disease, but since it all has to do with the inflammation, whether it's in your artery or whether it's in your joints, if we would make the lifestyle changes, we would prevent and reverse 90% of our disease, which is mind-boggling.
Yeah,
there is not one single drug that can prevent or reverse the plaque. The statin drugs you hear a lot about. If you actually look at what happens with statin drugs, and there's been a lot of research, there's an excellent book, it's called Overdosed America by John Abramson. He's a Harvard physician. If you read the book, you'll probably never go back to see a doctor again in your life, but he's a Harvard physician, so people can't say, well, what does he know?
Right.
But he has a whole chapter in there on statins, and what he points out is that if you take a statin drug, you will not live one day longer. You'll die of something different, but you will not live one day longer. Statin drugs in women are especially a bad idea, especially women under 65. Women under 65 who take statin drugs have a higher death rate. The only group that it benefits at all from statins are middle-aged men with known heart disease, but they still will not live one day longer.
So ultimately, there is not a drug that you can use to prevent or cure heart disease. So what Dr. Soly has explained to us is that heart disease is not preventable or curable by one drug, that it is a lifestyle change that actually has about 4 facets, which is what you preach and teach and live at your health center there in Yarwitchport. I want to thank you so much for coming on our show, for explaining to us in such great detail about coronary heart disease, how it forms, and ultimately what the mindset that we need to have to change it, or actually prevent heart disease would be to understand how it's formed and then a willingness to change our lifestyle. Thank you for joining us on HealthWise Alternatives. We look forward to seeing you once again. This season on HealthWise Alternatives, we will be interviewing holistic medical doctors, practitioners, and counselors who will explain natural medicine approaches to health and disease. HealthWise Alternatives is created by The Woman in You and Take One Films. Check our website, thewomaninyou.info, for scheduling information or contact your local cable access.